on your nervous system regulation and somatic healing journey of recovery from chronic pain, anxiety, panic. Don't get the procedure, the surgery, the injection, the infusion, the implant, the pump. Don't get any of that medical stuff without calling me first. Okay, on my journey, being bedbound for a year with chronic pain, year before that, deepening into chronic pain, years after that, coming out of chronic pain and anxiety and panic attacks and gastritis and going to the ER, I learned a lot. So that's why now I'm a professional coach helping all my clients either dramatically reduce or completely eliminate their sensations of chronic pain, anxiety, panic, and other neuroplastic conditions. The range is very wide. Everything from migraines to obesity. My specialty is clearing trauma. I go by the name Healing Wolf because not only am I always healing, but my ancestor, Sir Marquardt Werner Wolf, was the first wolf, and in Switzerland in 1290, he held that name and was a knight and defended the warriors. He defended people on a transformational journey. And that's what I'm doing here. Now, his defense was way more violent than mine. I'm moving you to a more peaceful state. So we differ in that. We definitely are really, are really on the opposite end of the spectrum, but we have the same passion for helping others. Now, when I talk about you shouldn't get any of this stuff without, like, don't get the procedure, don't get the back fusion, don't get the injection, don't get this stuff before you talk to me. The reason why is because there are better options, and I'm going to give you those options at the end of the video, so please stick around. First, I'm going to tell you about a stage of the journey that almost everybody goes through. It's called medicalization. In medicalization, you get medicalized. You go to a doctor with a neuroplastic condition, and generally, most physicians have no clue about the way the unconscious mind and the nervous system can get wired up to send sensations as protection sensations, and not even have any reason to send them except for wanting to keep you alive. Like they're responding to a threat that isn't there, a trauma that happened a long time ago, a worry that's never going to happen. They're responding to data that is useless in terms of your survival, but they think they're doing you a favor. Your unconscious mind thinks you're doing you a favor. Your nervous system gets all dysregulated, trying to lock you down so you won't go and do dangerous things like talk to other people, right? Go into crowded places, right? So on my journey, I got medicalized, and my medicalization I'm going to use as an example of what can happen and what does happen to almost everybody. Almost every client that I've worked with tells me this story of going to, in my case, I think it was 7 doctors, but some go to even more, a dozen doctors. And the doctors hit them with all kinds of stuff. They don't come to me and ask first. They do nerve blocks. They do pain pumps. They do spinal fusions. They do spinal stimulator implants. They do injections of steroids. They do lots of drugs. They gave me probably a dozen different drugs to see if they would help with the chronic pain sensations. And ultimately, they only made it worse. They all had side effects. I had to go on them and taper off of them and deal with withdrawals. And I mean, so on my own journey, I had, thankfully, physicians who didn't push me to do those procedures. And so I did receive a couple of injections. One was a steroid injection, one was from a naturopath. And the second one from the naturopath, which was some numbing agent ready for an ozone thing, I don't know. It was really stupid of me to accept that. It was kind of pushed on me the same week that my father died. So my nervous system was already really dysregulated. I was really, really in a deep state of shock and grief and not ready for any procedure, let alone a shot into my hip, which numbed the nerve and caused me to be paralyzed, which then gave me allodynia. I mean, so this is why I'm saying to you, before you do the procedure, I don't care who you are, reach out to me, find a way to reach me. Facebook message, YouTube comment, go to my website, healingwolfcoaching.com, and let's do a quick consult, because I guarantee you have a better, more benign option first, right? It's not going to make your medical doctors or any of the people giving you these things, these shots or whatever, it's not going to make them any money, but it's going to help you in a more gentle way to just back up a second, take a deep breath, and move with clarity, with wisdom, the wisdom of others who've come before you. And yeah, you might need to go through this stuff. A lot of my clients do, and bless them, it's fine. The good news is, even if you do go through these procedures, you heal. The body heals. So it doesn't matter if you've gotten a procedure and somebody snipped something or put a fusion in or whatever they've done, you could still get better. So that's great news. And it's great news to have such an amazing, beautiful body. Thank you, God. Thank you, universe. Thank you, all my cells. Thank you, my heart, my repair mechanisms, my stem cells, my autophagy systems, all of that. Thank you so much. So back to what I was talking about. Before you do the stuff that has a lot more side effects, a lot more risks, go for the mind-body approach. Okay, go for the mind-body approach, which there's so much research now that this approach is way more effective than that medical stuff. And it's scaring the establishment, because some establishment is embracing it and others are like, oh man, we're not going to do all these spinal surgeries anymore. People are going to be doing like pain reprocessing techniques and talking and getting better. How are we going to monetize that at the level we have before? We can't charge $20, $30, $50, $100,000 for a surgery when somebody is going to get talk therapy at $100, $200 an hour. I mean, that's pennies. And so what I'm saying is, spend the pennies first. Hire me. If you want to spend more, hire another coach. Hire a mind-body physician who maybe is going to charge you even more, but they'll be a physician. They've got that longer training. They had more student loans than I had. I've got a degree in natural science from New College. It was very affordable at the time. And even all my trainings, I haven't needed to take out loans. I just work hard to pay for the continuing education that I'm getting. And I've lived it. So I did pay a lot in terms of my life, in terms of years and years and years spent in the pit of hell, finding my way through so I can help you. So let's get back to this. Before we do, please subscribe to my channel. I want to help people out of hell. So the more subscribers I get, the more comments, thumbs up, ring the bells I get, the better able these videos are to reach people who they can actually help. Okay, so otherwise they get to the wrong people. So when you subscribe, you send it out to people like you who are ready to transform, who are on a growth journey. Back to the topic at hand. Before you get the procedure to stop the chronic pain in your back or your leg or your migraines or whatever, before you get the procedure, talk to me first. Don't get the procedure without talking to me first. Because even if we don't work together, which hopefully we will, because I really accelerate healing for my clients. I get them way down the road, really a lot faster than if you do it on your own. And I've seen this online. I got people sometimes who will reach out to me with a few questions. I said, hey, let's do a consult, and we become Facebook friends. And then 6 months later, they're still asking the same questions. They're still stuck in a loop, so to speak. Whereas one good session with me, they're out of the loop, they're on their way. Sometimes all it takes is 1 or 2 sessions with me, usually three max, and then ascension in healing, in somatic healing. And they're on their way, and they don't really need that one-on-one as much. But I'm here to provide it if you do need it. So why should you go the Mindbody route? Even just buying a book like Dr. Schubiner's new book, I think it's called Unlearn Your Pain, or Dr. Hanscom's new book, which is, I think, Calm Your Mind, Heal Your Body, something along those lines. They're both kind of bland titles, but they're amazing. Physicians, I've read their earlier books, so I can speak from that knowledge, and their earlier books helped me a lot on my journey. So if you do nothing else, buy one of those books and move forward with the protocols that they suggest. Practice some of the vagus nerve resets and some of the hacks that I offer here on this YouTube channel. Be consistent with it. Like, do it regularly. You can even go to my website right now, healingwolfcoaching.com, sign up for my mailing list. You're going to get a free download of my most powerful somatic healing meditation. Just do that every day. 15 minutes. It's very relaxing and incorporates so many of the techniques that I offer here on my YouTube channel. Now, it's not going to be as powerful as working one-on-one with me or with another accomplished coach who has been to hell and knows what they're doing, but just that somatic meditation alone can really help. So go grab that. And if you'd like to book a consult and work with me, then please also do that at my website, healingwolfcoaching.com. There are so many options in the mind-body space in terms of techniques, and the techniques have like zero downside, right? There's no side effect risks to meditation. There are no side effect risks to gentle, relaxing breath. There's no side effects risks to lion laughter yoga. There's so many techniques that I want you to do first before you go for the procedure or the surgery. So always reach out to me first. If you're thinking about doing it, don't have the procedure without checking with me. Why? Because I love you. I don't want you to go through that, what I went through. It was hell, and I don't want anybody going through that. I don't care if we never met face to face. I still feel that love and compassion for you. So check out these videos, keep moving forward, and I'll see you in the next one.